Hello everyone. My name is Shiraz Mumtaz. My today's topic is the function of the pulmonary surfactant. Okay. Objective is what is the surfactant? What is the respiratory distress syndrome, and how do we treat the distress syndrome, the commonly known as RDS. Okay. So first of all, we need to understand, the organization of it. Though the single unit of the lung, which is the alveoli, okay, the alveoli consist of the alveolar sac and alveolar duct. The collection, the one alveoli, the alveoli is the plural form. The one alveoli is the one single alveoli is alveolus. Okay, the each alveolus, okay, it is the consist of the extensive network of the capillaries and the elastic fibers. Capillaries to get the oxygen from the environment and release the carbon dioxide into the environment, and the elastic fibers, that give the elasticity so that it can actually expand or relax. Okay. Elastic fibers recoil, okay, during the expiration, and that helps in the what is it called, to push the air outside of the lung into the environment. Okay. The cellular layer, what they consist of, their type 1 pneumocyte, which is the alveolar cell by itself, which helps in the gaseous exchange. The type 2 in pneumocyte is alveolar cell that helps in the secretion of the surfactant, which helps actually um, with the keep the lung expanded and reduce the surface tension actually. Okay. The other cell that we have, it is the alveolar macrophages, okay, that actually helps in the fight the infection within the lung, that actually help in the engulf the pathogens and the debris, which is the dead cells. Okay. Respiratory syndrome, RDS, happen because of the inadequate surfactant production. Usually it happens in the premature birth. Okay. The alveoli, they have the blood-air barrier, that we have the blood CSF barrier, okay, the blood-brain barrier, okay. The same thing, we have the blood-air barrier, which is consist of the alveolar epithelium, the capillary endothelium, and the fused membrane within the capillary and then epithelial alveolar epithelium, which is going to come in next slide. So right here, this is the alveoli and this is the capillary. So right here, as you can see, this is the alveolar epithelium. This is the capillary endothelium, okay, and this is the capillary by itself, okay. All right, so right here we were talking about what is it called, a type 2 alveolar pneumocytes, okay, which produces surfactant, okay. And then we have what is it called, the interstitial fluid with then very limited, okay. And then we have the capillary, as it say right here, this is the capillary right here, this is the capillary endothelium. This is the fused membrane, and then this is what is it called, a alveolar epithelium. And then this surfactant right here, which is the thin form right here, which is the kind of a light blue or little bit dark blue in color. This is secreted by a type 2 pneumocyte. Okay. Lung collapse. Okay. If the lung have the tendency to collapse, okay, and is prevented by a two factors. Okay. The one which is the elasticity, okay, the elastic recoil, okay, of the chest, that actually helps in the what is it called, keep the lung open, okay. And the other one that we have, which is the surfactant, okay. So the surfactant helps, what is it called, minimize the tendency to collapse, and as I said earlier, decreasing the or lowering the surface tension. When the lowering the surface tension, it can help in the keep the lungs opening. Without the surfactant, a lung is going to collapse, okay. And the nevertheless, any alveolar collapse reduce the total surface area of exchange. So if there's no surfactant, there's a collapsed lung, there's going to be a reduced what is it called, a surface area, and there is no air is going to be what is it called, able to exchange from the lung. Okay. All right. So the factors affecting the pulmonary, what is it called, ventilation. Okay, the resistance to the airflow, broncho. If you need a increasing the what is it called, what is it called, surface area, there is the bronchodilation. It happened when the sympathetic activation happened and decreases the resistance to the airflow. When there is decreased resistance to the airflow and increased sympathetic activation, there is going to be a bronchodilation. That is actually used in the bronchodilators, like albuterol, salmeterol. Okay, they are used in what is it called, bronchodilation in the time of asthma. Okay, the bronchoconstriction happen, like the time of parasympathetic activation. Okay, and increase in the resistance. Okay, that usually happen at the time of rest. Okay, resting, you don't need much of an oxygen, and not much of a, like not much of decreased resistance you need. Okay, because you're resting, you don't need much of the airflow. Okay. Lung compliance. Okay, there is, like lung compliance is measure of distensibility. Okay, how much lung can inflate, okay, at given amount of pressure. Okay, and elastance. Okay, how the lungs are elastic. Okay, so the more the elasticity, the better is going to be, what is it called, the is going to be able to call it, a high elasticity of the lung is the, like the stiff balloon, and it is difficult to inflate. The more the lung compliant, okay, for the little amount of change in pressure, it is going to inflate. Okay, so it's going to be easy to inflate, and it is become very difficult to deflate. On the other hand, if you have high elasticity, it is going to be difficult to inflate, which means inhale. Okay, and easy to deflate. Okay, all right. So now right here we have the factors affecting the pulmonary ventilation, the connective tissue. Okay, the level of surfactant production, and then mobility of the thoracic cage that we have. Okay, so the connective tissue. Okay, the so if you have what is it called, loss of the elastic tissue, like as in what is it called, one of the condition called the emphysema. Okay, so it will gonna cause increase on the compliance, but since there is no elastic fiber, so it is going to be decreasing the, what is it called, a pulmonary ventilation. Okay, and the level of surfactant production. So if you have insufficient surfactant production, that is going to be a decrease in the compliance. Okay, and this is causing a, what is it called, uh, the respiratory distress syndrome. Okay, the mobility of the thoracic cage, which is much needed. Okay, so for example, there's decrease in the rare form of the arthritis. It can happen. Usually arthritis is supposedly with a joint, the larger joints, especially the knee joint, but nevertheless it can happen to the thoracic cavity as well. Okay. All right. Now we're going to discuss about what is it called, the respiratory distress syndrome. Okay, in the preterm infants. Okay, the possible impact of the surfactant application techniques. Okay, so the objective of this research is what is called a prematurity. Okay, is one of the most common cause of parent issues in the perinatology. Okay, in the prenatal wards. Okay, so you're going to see that the postnatal pathology connected with a prematurity is what is it called, is a respiratory distress syndrome, which is the RDS, as I said earlier, which in which the insufficient production of the surfactant, and due to which there is a decrease in the like due to which, like, the lung immaturity happens. Okay, the lungs are not immature because of the decreased what is it called, surfactant production. Okay, and because of the lower the surface tension. Okay, development of the um, inefficient surface tension. Okay, the respiratory distress syndrome is one of the high causes of the mortality and morbidity. Okay, with mortality, which means causing the death, and morbidity, which is called the severe lung insufficiency. Okay, which can cause the short and long-term consequences, obviously. Okay, And the aim is to this research study aim is to compare effectiveness of the individual surfactant supply techniques, okay, and the treatment of the respiratory distress in syndrome in the premature infants, okay. So one of the, like, there are three methods actually used, okay, from the year that was called 2009 2013, okay. 198 premature infants have were used, okay, and they received a surfactant, okay, and then they found out that there are different kind they use the premature, and this, like in the first one they use a premature newborn with the substitute ventilation, okay, with the supply of the surfactant through the traditional, now we call endotracheal tube, okay. So average, like as you can see, they gave birth, like gestational age was like 26.6, okay, and then the mean birth age weight is like 911 gram, okay, which is very less, okay. So average Apgar score, okay, which is in 4 minutes is we call it the 4 in the first minute, and then the 6 Apgar score in the fifth minute after using the traditional endotracheal tube, okay. The next one that we have where they have the what is it called, a exogenous surfactant supplementation, which is the Ensure method, okay, which is the average gestational age, which is the what is it called, 28.3, okay, which means, like the average birth weight was well, like 111 1117 gram, okay, 1117 gram, okay. The mean Apgar score, like 6 in the first minute, and then the 7 in the fifth minute, okay. The other one they have used, or what is it called, this one was Ensure, okay. The other one which is used called Lisa, which is the less invasive surfactant administration, okay. No, it is the mean gestational age is 29.9 weeks, okay, and then the average weight is 1,444 gram, okay. So right here you can see this the Apgar score is 7 in first minute and then 8 in then fifth minute. So which is proven that the less invasive what is it called is much better as compared to the traditional one, okay, as it says in the result, okay. So so the what's it called, the minimally invasive surfactant administration, okay, which is MISA, and then Ensure is also causing the reduce the incidence of the RDS, and then compared to the traditional exogenous method, okay. Conclusion is non-invasive method of the respiratory syndrome, and then and MISA, LISA, okay, less invasive surfactant administration, and Ensure methods are very safe and effective in the treatment of the respiratory distress syndrome. Thank you very much. Okay, this is my references.